name is Cassie Baker. I'd like to talk with you about my chosen healthcare problem, weight loss in obese adults. In the United States, obesity is a significant healthcare issue. The Center for Disease Control defines obesity as a body mass index of greater than 30. According to data from healthypeople.gov, during the years of 2005 to 2008, 33.9% of persons aged 20 years and over were obese. According to Harvard School of Public Health, obesity is currently ranked second in number of deaths caused per year in the United States. In addition to increased risk of mortality, obesity is associated with increased risk of rates of heart disease, stroke, type 2 diabetes, and certain types of cancer. In reaction to the high rates of obesity, Healthy People 2020 set forth an objective to reduce the proportion of adults that are obese. As a result, effective weight loss management strategies are of paramount concern to healthcare providers. Advanced practice nurses, or APNs, are especially equipped to treat obesity. They are trained in disease prevention and health management. Also, due to the devastating impact that obesity can have on healthcare outcomes, APNs have a responsibility to their patients to seek and implement evidence-based approaches to weight loss and management. In order to investigate the problem of weight loss in obese adults and develop an evidence-based intervention, a literature review was conducted. 2 randomized controlled studies were chosen for review and critical evaluation and synthesis. The first study reviewed was the Saku Control Obesity Program, or SCOP study conducted by Nakade and Associates. This study was conducted in 2012 to examine the effects of weight loss program emphasizing behavior, diet, physical activity, and self-monitoring on weight loss. The intervention group participated in SCOP, which incorporated individual dietary counseling, group exercise sessions with a specialist, self-monitoring of weight and dietary activity, and use of a pedometer. The intervention group received 5 individual counseling sessions and 5 group sessions. The control group received usual care. Study findings indicate that this approach was effective for the improvement of health loss and maintenance. The intervention group lost more weight than the control group in both sexes, and the difference from baseline was found to be statistically significant. Even at 24 months, both sexes in the intervention group maintained these changes. The second study reviewed was the Group Support Lifestyle Modification Program, or GSLiM study. Jamal and Associates conducted this study in 2016 to compare the effectiveness of a group-based lifestyle intervention program to usual care on weight loss. The intervention group participated in GSLiM program, which includes self-monitoring, cognitive behavior sessions, exercise and dietary changes, and 3 full days of seminars and 10 group sessions over 24 weeks, during which participants met with dietitians, exercise specialists, and psychologists. The control group received dietary counseling once in 12 weeks. Study findings revealed that the GSLiM approach was more effective in achieving the targeted 6% weight loss. At 24 weeks, 19% of the intervention group achieved 6% weight loss, compared to only 4.1% of the control group. By reviewing this body of literature as a whole, evidence-based nursing practice can be informed. The SCOP study demonstrated that a lifestyle intervention that emphasized behavior, diet, physical activity, self-monitoring, and utilized group sessions was effective in decreasing weight, with changes maintained over 24 months. Similarly, the GSLiM study demonstrated that a group lifestyle intervention program was more effective than usual care in achieving weight loss. Both studies incorporated self-monitoring of physical and dietary activity, exercise and dietary changes, and group sessions with a dietitian and exercise specialist. The reviewed studies are of great value to nursing practice. First, they illustrate that achieving weight loss in obese adults is a problem requiring multiple interventions in collaboration and cooperation for significant changes to be accomplished. Also, lifestyle changes are a cooperative venture. Group sessions and professional feedback were helpful when coupled with self-monitoring. Lastly, although the weight loss changes were found to be significant in intervention groups, they were still only small changes made over a long period of time. This finding is valuable as a reminder that changes may happen slowly, but momentum towards the end goal, ultimately lifestyle change, should continually be encouraged and applauded. Findings of these studies can be put into practice through encouraging self-monitoring in combination with group sessions, incorporating dietary and exercise advice into practice, and providing regular feedback regarding progress, and collaborating with other professionals such as dietitians and exercise specialists to help accomplish weight loss goals for patients. Based upon the evaluation of these studies and synthesis of findings, an evidence-based intervention can be proposed. A lifestyle intervention that incorporates self-monitoring through logbooks, group sessions, group support systems, and access to dietitians, exercise specialists, and behavior specialists with the goal of achieving weight loss through changing lifestyles. The intervention would be available to all members of the community and implemented and led by an advanced practice nurse at a local community center working in collaboration with an outpatient primary clinic. Large group sessions would be conducted monthly and have rotating themes and guest specialists. For example, 1 month the focus would be on diet, then exercise, and so on. Each group session would include homework and goal setting. Participants would review logbooks and be given certificates for meeting personal goals or completing homework. Also, group members would be encouraged to break into smaller groups for activities and accountability. Ideally, these groups would meet bi-weekly to provide more frequent feedback and reinforcement. The ultimate goal of this intervention would be to achieve long-term weight loss and create lifestyle change that can be sustained indefinitely. As evidenced by this presentation, obesity is a significant healthcare problem in America, and advanced practice nurses and other healthcare professionals are seeking evidence-based interventions for this problem. It is my hope that through synthesis of evidence and implementation of an evidence-based intervention, long-term weight loss and lifestyle change can be achieved. Thank you.